guys, welcome back to my channel. This is the second episode of my weekly Q&As. For those of you who watched the first episode, you know the drill, and for those of you who have not watched the first episode, make sure that you do. And just to give you a brief overview, I'm going to be doing this weekly Q&A series in order to answer the most common questions that I get through my Instagram and the YouTube comments down below. So if you want me to answer some of your questions, make sure you follow me on Instagram at 15 Blades and comment below. Let me know what other questions you want me to answer. This week's episode, I'm going to answer some questions about oral maxillofacial surgery. As many of you guys know, I'm an oral maxillofacial surgery resident. I'm in my 4th year of 6, and I am going to get to some of your questions. I just picked up this latte, you guys. By the way, it's a pistachio latte from Starbucks, and I have to say, it's so delicious. I am not necessarily one to pay $6 for a drink, but I have to say that this one is worth it. And also, they're still using Christmas cups, even though we are well into January. So I don't know, Starbucks, you're kind of falling behind. Question number 1. How did you end up choosing OMFS? Very good question. So basically, in undergrad, I was always pre-med. With the MCATs, I thought I was gonna go to medical school. I thought that I was gonna do plastic surgery, and that was my dream. That was my goal. Then I did some research at one of the hospitals near my undergrad, UC Berkeley. I decided that I didn't really want to be in the hospital. I was doing research in the GI department, maybe not the best fit for me, but long story short, I thought this is not really the field I want to be in. I want to be a lot more hands-on, creative, and so I ended up shadowing a dentist and loved it. That dentist did a bunch of cosmetic work, and I thought, you know what, I'm gonna go to dental school, be a cosmetic dentist, and it's gonna be great. And so I went to dental school, and dental school is the perfect mesh of art and medicine. I went to dental school and then I hated cosmetics. I'm like, I can't do this. This is not for me. God bless you if you do cosmetic dentistry, because I think you have to be super talented and it's really hard to do. But I decided that it was not a good fit for me. Landed somehow in the oral surgery clinic, saw a couple of surgeries, fell in love, but decided really late. Like most people who want to do OMFS, you guys, are like diehard OMFS even before dental school. And so for me to decide to do OMFS in the end of my 2nd year, going into my 3rd year, was like way too late. People had really doubted whether or not I was going to match into a program. Luckily I did. It all worked out. We can talk about my journey in a different video, but that's how I ended up choosing OMFS. Is I felt like I really was going to be somebody who was able to use my hands, and surgery really spoke to me. One of the primary reasons I went into OMFS is because I really wanted to be involved in cleft lip and palate work. I was always involved in cleft lip and palate organizations when I was in undergrad, and when I was in dental school, I actually started my own organization, and it felt like out of all of the specialties, you need a ton of different specialties to take care of a patient with cleft lip and palate. It's like a multidisciplinary collaboration between tons of different specialties. Felt like in order the type of involvement that I wanted was with my hands. I wanted to make a surgical difference in these patients. And so that's what drove me to OMFS and why I decided to pursue that route. I have not done a ton of cleft lip and palate work during my residency. I hope to do a little bit more of that. But we do have an attending who's wonderful, who has a lot of experience in that. So hopefully I'll get some exposure, and you know, it could be part of my future as well. That's why I chose oral maxillofacial surgery, OMFS. I know it's a mouthful, you guys. Okay, how many hours do you work per week in residency? Whew. Okay, so it depends on the week, depends on what service I'm on. I'm in general surgery intern year this year. I did my OMFS intern year last year. This year, we don't do 24s. We don't do home call. When you're on call, you're in the hospital. In OMFS though, I did home call. So technically I can be on call for 36 hours straight, because you do like a 12-hour shift and then you're on call for 24 hours and then you do another 12-hour shift. So then it ends up being like 36 hours by the time you're like officially home and not on call. So that's a little bit different. If you have a couple of those days, as you can imagine, it will add up. But technically, there is a organization, the AGME, who basically comes up with a lot of the guidelines for residencies, and you have to follow them if you want to be accredited. And the rule is you can't work more than 80 hours per week. Here's the catch, averaged over 2 weeks. So technically you can work 60 hours one week, and then you can work like 100 something hours the next week. And then if they average to be 80 hours per week, then that is the limit. And so technically, usually most of the time, I'm working about 80 hours a week, give or take. Some weeks a little bit more, some weeks a little bit less. I think the most I ever worked was like 110 hours in a week. Yeah, it was a lot. Yep. Surgical residency. If you specialize in, this is question number 3. If you specialize in OMFS, can you still work as a dentist? The answer is actually no, surprisingly. So in dentistry, if you specialize, you have to work within your specialty. Meaning, if you become a pediatric dentist, you cannot treat adults. If you are an oral maxillofacial surgeon, you have to practice within your scopes. So the good thing is the scope for an oral maxillofacial surgeon is huge. So you could do implants, you could do cosmetic stuff, you could do tumors, you could do all sorts of things. You could do extractions, of course, it's our bread and butter, but you cannot be doing fillings, for example, because that falls under general dentistry. You can't be, but within oral maxillofacial surgery, you can treat kids as long as it's a oral surgery procedure. So a lot of times we get referrals from orthodontists and pediatric dentists to expose impacted canines or to extract premolars and all of that stuff. So of course I can work on pediatric patients as well as adults, but a pediatric dentist cannot work on adults. So it is a little bit complicated. I know there's a few loopholes, a few exceptions. We won't really get into that, but that's the gist of it is once you become an oral maxillofacial surgeon, you have to work within the scope of your field. 4th question, last but certainly not least, if you could do it all over again, would you still choose to be a surgeon? Wow, what a loaded question. Let me just tell you, to be quite honest, I am on my anesthesia rotation right now and my life is amazing. I'm like so refreshed. I go into the hospital, I'm not working more than 8 hours a day. And I was doing surgery, I'm doing like more like 12, 13, 14 hours a day. I'm waking up at 4:30 in the morning. I'm getting home at 7 p.m. I barely really have time for myself. Anesthesia life is like amazing. So I've had a few moments where I've been like, oh my God, why did I do this to myself? Why am I not in a different residency program? Or why am I not living this other life, you know? But to tell you the truth, even though I've had these fleeting thoughts, when I am in the operating room and I'm on the other side of the sterile sheet, because a lot of times in surgery, they'll put up a sterile barrier between anesthesia, who's not sterile, and the surgical field, which is sterile. I'm like itching. I'm so eager. I want to go around the sterile field so I can see the surgery and be part of the surgery. And I'm always like peeking over the little drape. And so, you know, yes, the lifestyle in residency of surgery is not ideal whatsoever. Everybody knows that. Like everyone in medical school and dental school knows that if you're gonna go into a surgical residency, you're gonna work. You're gonna work. Everyone knows this. That's just the way it is. And it is getting better. A lot of, you know, residency programs are trying to focus on wellness and make sure that residents aren't working too many hours. And so it is slowly changing. The old culture of like, if you're a surgical resident, you're basically living in the hospital for 6 or 7 or 8 years of your life. But it is still probably the most difficult specialty in terms of how long you spend in the hospital and how much you're on call and whatnot. You know, once you are done, once you graduate, once you're in attending, life could be dramatically different based on what it is you want to do. So if you want to be an attending in a hospital and take call, and if you're a trauma surgeon, then yeah, you know, your schedule is going to be really difficult. But if you're going to be an oral maxillofacial surgeon like me, you can open up a private practice and work 4 days a week and set your own schedule, and then maybe do 1 day in the hospital and be a part-time attending, and you totally have that flexibility to do that. And so I'm looking forward to that life, and I know that I just have to put in my time so I can learn. And the way I'm thinking about it is, you know, right now, yes, I am not at home as often as I want to be, and maybe I don't have time to do all the things I want to do, but you know, I'm doing all of this work now. I'm learning as much as I can. I'm absorbing as much as I can so that in the future I could have the lifestyle that I want, but with all of the experience that I got in residency. And you can't really get all of that experience, and you can't see all of that, and you can't train, and you can't get all of the education you need if you're not able to go through all of those hard years of residency. Honestly, do you really want a surgeon to cut into you that hasn't done this like 100 times? Well, in order to do it 100 times, you have to be in a hospital all the time. So, you know, that's just the reality. That's how it is. You have to be able to get a certain number of procedures under your belt. And that's why surgical residency is so difficult. It's because you need to physically be there doing things all the time. And that's how you learn. Those are the 4 different questions about OMFS. If you have more questions about OMFS or anything else that's going on, or this pistachio latte, go ahead and comment below in this video. Also release other videos within the week, so make sure you check those out as well. I do have a video about OMFS on my path here and how to be a competitive applicant, so don't forget to watch those videos, and follow me on Instagram at 15blades for more posts like this, and I'll see you guys next time. Bye.